Do you wake up with a stiff neck, back pain, or a heavy, aching head, and just brush it off as stress or bad sleep? What if I told you there's one hidden stress muscle in your body, quietly destroying your neck, back, and even causing your headaches? Most people have no idea this muscle even exists. But when it becomes overactive, it can pull your posture out of alignment, compress your nerves, trigger constant tension and pain, and here's the scary part. You're probably doing daily habits that make it worse without even realizing it. In this video, I'll show you what this stress muscle really is, how it silently damages your body, and the simplest way to fix it at home, so watch carefully. Because once you understand this, you might finally get rid of that pain for good. The trapezius muscle is the most superficial muscle of the back and neck, and it consists of 3 parts: upper, middle, and lower. It is one of the most common sources of pain caused by trigger points. Very often it is responsible for discomfort between the shoulder blades, shoulder pain, and even headaches. The trapezius is also known as the stress muscle, especially the upper portion, which becomes overloaded due to poor posture, long hours at the computer, driving, or chronic stress. There are 7 common trigger points in the trapezius muscle, each producing a specific pattern of pain. The first trigger point is located in the middle of the upper trapezius, can be easily found by pinching the muscle near the neck. Pain from this point usually spreads to the neck, but if highly irritated, it can radiate to the temple, behind the eye, the jaw, the back of the head, and even the lower teeth. It may also cause pain in the ear or shoulder. The second trigger point is slightly lower and closer to the shoulder, often causing a dull, aching pain behind the ear. If these upper trigger points become inflamed and affect nearby muscles, such as the levator scapulae, even simple movements like turning the head can become painful and restricted. Moving further down, the third trigger point is found near the lower edge of the upper trapezius and often feels like a tight knot. Pain from this point travels upward along the neck to the base of the skull and clavicle, while also causing deep discomfort over the shoulder blade. The fourth trigger point is located near the shoulder blade and creates a burning sensation along its inner edge, close to the spine. The fifth point lies in the middle trapezius and is responsible for the common pain many people feel between the spine and the shoulder blade. The sixth trigger point is less common and is found where the muscle attaches to the shoulder joint, causing sharp, stabbing pain directly in the shoulder. The seventh point, which is quite rare, sits just under the skin in the central part of the muscle and produces a strange, vibrating or tingling sensation along the outer arm. These trigger points can develop for many reasons. Sometimes it is due to acute injuries like falls or whiplash. In other cases, the muscle becomes strained from overuse, lack of rest, or even exposure to cold. However, the most common cause is poor posture. Sitting with the head pushed forward and the neck under constant tension, especially while using a computer or driving, puts extreme stress on the trapezius muscle. In some cases, the root of the problem lies deeper in the body. For example, differences in leg length or pelvic imbalance can cause the pelvis to tilt, leading to spinal misalignment and uneven shoulders. As a result, the upper trapezius is forced to work excessively to keep the head balanced, remaining in a constant state of tension. Similar strain occurs when sitting improperly with a computer mouse, raising one shoulder higher than the other, or during repetitive activities like playing the violin. Even habits such as sleeping on the stomach or making sudden neck movements can activate these trigger points. You can perform a simple self-check. If the upper trapezius trigger points are active, you may find it difficult to lift your arm to the side or tilt your head toward your shoulder. Your range of motion may be significantly reduced, sometimes even below 45 degrees. Middle trapezius becomes overloaded when the arms are held forward for long periods, while the chest muscles tighten and shorten. This imbalance causes the middle trapezius to weaken and stretch, leading to rounded shoulders, forward head posture, and chronic pain between the shoulder blades. The lower trapezius is also affected, becoming weak and overstretched when you spend long hours looking down at your phone or bending forward during daily activities. The most important thing to understand is that upper trapezius is almost always overworked and tense. while the lower trapezius tends to be weak and underactive. This imbalance is a key factor in the development and persistence of pain.
Ow.
The lower part of the trapezius is often overstretched and weak. Therefore, if you truly want to get rid of trigger points permanently, your treatment program must include exercises that specifically strengthen and activate the lower trapezius. Eliminating pain caused by trapezius trigger points at home is absolutely possible with the help of a massage roller and massage balls. By using a large foam roller for several minutes, you can apply mechanical pressure to the 3rd, 4th, 5th, 6th, and 7th trigger points. A massage ball provides deeper, more targeted pressure on specific trigger points. If you find an area with increased tension and pain, press firmly on it for about 30 seconds. Double massage balls are especially effective for working on the 1st and 2nd trigger points when used against a wall or while lying on the floor. They also help massage the muscles along both sides of the spine. After applying mechanical pressure to the trigger points, it is essential to stretch the tight upper trapezius and strengthen the weakened middle and lower parts. To gently stretch the upper trapezius, slowly tilt your head toward one side, bringing your ear closer to your shoulder. Very important detail. The shoulder on the side being stretched must remain relaxed and should not lift up. Find a comfortable stretch and hold it for 1-3 minutes. Maintain slow, deep breathing. Try this technique. With every 4th exhale, consciously relax more and allow the muscle to lengthen further. For even better results, perform this stretch. In a warm shower, heat relaxes the muscles and makes stretching much more effective. To strengthen the weakened middle and lower trapezius, try the following exercises. Hold a 1-liter water bottle, a stick, or a similar object in your hands with your palms facing downward. As you inhale, move your right arm backward while extending your left arm forward in the opposite direction. As you exhale, return to the starting position and pass the object to the other hand. Then repeat on the opposite side. Perform this exercise at least 10 times. After that, switch your hand position so your palms face upward and repeat the same movement again. Another effective exercise targets all parts of the trapezius muscle. Hold a bottle or stick in one hand and pass it to the other while moving your arm down and then up over your head. Continue this motion in a smooth, controlled way, creating a figure-8 pattern with the object. Repeat this movement at least 10 times, then reverse the direction. Pay attention to how your shoulder blades and trapezius muscles actively engage during this exercise. In addition to dynamic strengthening, the trapezius also needs static loading. You can perform any variation of a glute bridge, either with support on both arms or one arm. Hold the final position as long as you comfortably can while breathing steadily and engaging your back muscles. If this exercise feels too difficult, lie on your stomach, extend your arms to the sides, and lift your arms, legs, and head simultaneously. Hold the position as long as possible. Then repeat with your arms extended forward and again with your arms positioned backward. These variations help strengthen all parts of the trapezius muscle. Dentists, IT professionals, office workers, anyone who spends long hours sitting, this is especially important for you. Proper workplace setup is essential. Your elbows should always have comfortable support. This is the foundation. Often, we become so focused on the screen that we completely forget our posture, and the head gradually moves forward, creating unnecessary strain. Make it a rule. Every 30 to 40 minutes, step away from the screen. Do a simple stretch, or even better, use a massage ball against the wall to release muscle tension. This only takes a couple of minutes, but your back will thank you. While sitting, lean back into your chair and support your shoulder blades. Allow your muscles to relax. Ideally, your chair should support the natural curve of your lower back. If it doesn't, use a small pillow or an orthopedic cushion. This simple adjustment can make a big difference. Another important point. If you already have painful trigger points in your trapezius, avoid sleeping on your stomach with your face pressed into the pillow. This position increases tension and worsens the condition. For women, it's also important to avoid tight or narrow bra straps that dig into the shoulders and compress the trapezius muscle. Choose soft fabrics with wider straps and occasionally adjust them during the day to relieve constant pressure on the muscles. Thank you for watching this video until the end. If you found it helpful, share it with friends and colleagues who also suffer from neck and back pain. Let's help each other stay healthy. Be sure to check out my playlist for more useful videos on how to eliminate pain. Stay healthy, and I'll see you in the next video.